This is a story that came out in Philly Voice, March 19th, 2018. The other opioid plague. Hospital shortages lead to patient pain, medical errors. Even as opioids flood American communities and fuel widespread addiction, hospitals are facing a dangerous shortage of the powerful painkillers needed by patients in acute pain, according to doctors, pharmacists, and a coalition of health groups. The shortage, though more significant in some places than others, has left many hospitals and surgical centers scrambling to find enough injectable morphine. Wow. Drugs given to patients undergoing surgery, um, fighting cancer, or suffering traumatic injuries shortfall, which intensifies since last summer, was triggered by manufacturing setbacks and a government effort to reduce addiction by restricting drug production. As a result, hospitals, pharmacies, are working long hours to find alternatives, forcing nurses to administer second choice drugs or delivered standard drugs differently. That raises the risk of mistakes and already has led to at least a few instances in which patients receive potentially harmful doses, according to the nonprofit Institute for Safe Medication Practices, which works with healthcare providers to promote patient safety. In the Institute survey of hospital pharmacists last year, one provider reported that a patient received 5 times the appropriate amount of morphine when a smaller dose vial was out of stock. Another case, a patient was mistakenly given too much sufentanil, sufentanil, which can be up to 10 times more powerful than fentanyl. Wow, they got drugs more powerful than fentanyl. That's crazy. The ideal medication for that situation. In response to shortages, doctors in states are far flung as California, Illinois, and Alabama are improvising the best way they can. Some patients are receiving less potent medications like anacetamine or muscle relaxants as hospitals direct their scant supplies to higher priority cases. Other patients are lavishly in pain because preferred. More powerful medications aren't available. So they're having a shortage of pain medication. Wow. Because they have to wait for substitute oral drugs to kick in. The American Society of Anesthesiologists confirmed that some elective surgeries, which can include gallbladder removal, and hernia repair, have been postponed. In a February 27th letter to the U.S. Drug Enforcement Administration, a coalition of professional medical groups, including the American Hospital Association, the American Society of Clinical Oncology, and the American Society of Health System Pharmacists, said the shortages increase the risk of medical errors and are potentially life-threatening. In addition to having diminished supply of these critical drugs or no supply at all can cause suboptimal pain control or sedation for patients, the group wrote. The shortages involve pre-filled syringes of these drugs, as well as small ampoules and vials of liquid medication that can be added to bags of intravenous fluid. Drug shortages are common, especially of certain injectable drugs, because few companies make them, but experts say opioid shortages carry a higher risk than other medication. Given the wrong dose of morphine, for example, can lead to severe harm or fatalities, explained Michael Gagnon, medication safety expert at the American Society of Health System Pharmacists. Calculating dosages can be difficult, and seemingly small mistakes by pharmacists, doctors, or nurses can make a big difference, experts say. Marcel Berknell, a nurse at St. Louis University Hospital in Missouri, said it would be easy for medical mistakes to occur during a shortage. For instance, in a fast paced environment, a nurse could forget to program an electronic pump for the appropriate dose when given a mix of intravenous fluid and medication, which she was unaccustomed. That is scary. That is scary. So we got a drug plague in the country, and at the same time, there is a shortage of opioids in the hospitals and among the surgical offices. And now they have to use alternatives for people that need the drug or having surgeries. Boy, if this is not the bizarro world, I don't know what is, y'all. This is absolutely insane. I never seen nothing like this in all the years I've been alive. Please tell me what you think. I'll leave the link to this article in the description box, but hospitals are now having a shortage of opioids. And they are scrambling to use all other types of medicine, and they know in using these other alternatives, they can easily make fatal errors that can end a person's life. Tell me what you think. This is crazy. Please leave your comments and subscribe. Don't forget to hit on the notification bell twice and join me on Black Junction TV and blackspot.com. Peace, family.